Disseminated intravascular coagulation, or DIC, is a syndrome of activated coagulation that is characterized by bleeding or thrombosis. It is a complication in diseases and other conditions that accelerates clotting within the body. This also causes occlusions in small blood vessels, organ necrosis, and depletion of circulating clotting factors and platelets. DIC is most likely to happen in people with certain conditions, including sepsis, a recent severe injury or surgery. It can also happen in people with cancer and in rare conditions in pregnant women. The symptoms depend on the condition that is causing the DIC and whether the DIC is acute or chronic. Acute DIC, as I stated earlier, often is related to a serious illness such as a bloodstream infection or sepsis, certain types of cancer, or a rare problem during the second trimester or the second half of a pregnancy. People with acute DIC are often very sick. Common symptoms of acute DIC include bleeding too easily. People can bleed easily from cuts in their skin. They can also bleed out of different areas of their body that a person wouldn't normally start bleeding from. They would also have bruises on their skin and things like that from internal bleeding as well. They also get blood clots too easily, and they can form in different areas or organs within the body, depending on the part of the body that's involved. Symptoms of these blood clots could include swelling, redness, or pain in the leg. It could also include trouble breathing or chest pain when taking a deep breath. People with acute DIC could also experience confusion, trouble thinking, and even possibly slip into a coma. People with chronic DIC usually only have mild symptoms, but they can also have blood clots as well. There are several tests that help a doctor decide if a person is likely to have DIC. While not one test in particular can really say for sure, the doctor will check the person's medical condition and also do some blood tests to measure clotting within the body. Platelet counts in DIC are typically low with a downward trend, especially in acute sepsis-associated DIC. Fibrin degradation products, including D-dimer, are elevated. D-dimer is useful in the diagnosis and the monitoring of DIC. Prothrombin time would be prolonged. Activated partial thromboplastin time would also be prolonged, and the fibrinogen level would be low. The complete blood count, or CBC, is going to show low hemoglobin with levels less than 10, and leukocytosis as well. First and foremost, when a nurse is taking care of a patient with DIC, it's important to recognize early signs of abnormal bleeding and to promptly treat those signs and symptoms so that future bleeding is stopped. It's important to use anti-embolism stockings to prevent VTE. It's also important for the nurse to cluster activities for the patient so that they get adequate rest and to reduce their oxygen demand as well as their energy expenditure. It's important to institute safety and bleeding precautions to minimize the patient's risk for injury. And it's important to administer the blood component therapy as ordered by the doctor and to watch for transfusion reactions and signs of fluid overload in the patient. Medications for a patient with DIC would include replacement therapy with administration of fresh frozen plasma, platelets, and fibrinogen concentrates. Anticoagulants would be given, concentrates of coagulation inhibitors, such as recombinant activated protein C or antithrombin 3 would be given. Antifibrinolytic agents would be given. Broad spectrum antibiotics may need to be given. Oxygen therapy may need to be administered, as well as fluid replacement. DIC can rapidly lead to organ failure and is often fatal if it's not found early on and treated properly. The overall mortality for DIC is difficult to establish due to the severity and the variety of the underlying conditions that are also present. However, it's been estimated that the mortality rates for sepsis and Severe trauma will double if DIC develops within the patient. DIC can also cause organs to be destroyed by infarction, as well as limb ischemia, which can lead to the loss of digits or even limbs. However, with appropriate care, DIC patients can see a favorable outcome. The prognosis mostly depends on the underlying condition, but can also be based on the severity of DIC as well as comorbidity.